This video is presented to you by AEDmarket.com, and in today's video, we'll explain how to use an AED on a child or infant. One common question we receive is whether AEDs work on children. The answer is yes, but it's important to follow specific guidelines. AEDs are designed to be used on children, and with the correct procedures, they can be life-saving. Pediatric pads. Many AEDs come with pediatric pads or a pediatric mode. Pediatric pads deliver a lower energy shock suitable for children under 8 years old or weighing less than 55 pounds. Place one pad on the center of the child's chest and the other on the center of the back. Using adult pads. If pediatric pads are unavailable, you can use adult pads with specific placement. Place one pad on the upper right chest and the other on the child's back between the shoulder blades. This ensures the shock passes through the heart. Pediatric mode. Some AEDs have a pediatric mode that adjusts the energy level. Activate this mode if available and follow the device prompts. Training. While AEDs are user-friendly, training in CPR and AED use can improve confidence and effectiveness, especially with children. Training programs often include practice on child and infant mannequins. Prompt use. Using an AED promptly can significantly increase a child's survival chances in cardiac arrest. Start CPR immediately and use the AED as soon as possible. In summary, AEDs are safe and essential for children in cardiac emergencies. Follow the guidelines for pad placement and device prompts to deliver life-saving care effectively. If you have any questions or would like to explore our AED and training program options, visit us at www.aedmarket.com.